AWP Voices, your people promise in action.
Hello and welcome to We Are AWP Voices. Today we're joined by Ben Stunell, Peer Support Worker and Involvee, Kez Bradley, Senior Autism Community Link Worker, and Oriana Morrison-Clarke, Clinical Program Project Lead for the Kingfisher. We'll be discussing Autism Acceptance Month, chatting about the BAS service and the new Autism and Learning Disability Facility, the Kingfisher. So I guess if we can start with you, Kez, what can we do at work to support colleagues who are autistic to make sure they feel accepted and included?
So I think firstly it's about just being open to different ways of working and being mindful of difference, because often it's not a fact that an autistic person can't do a specific task or role. It's maybe that the way that they're being asked to do it isn't kind of conducive to their differences. So I think firstly it's about being open, and then it's about asking autistic people what they're going to need to kind of feel included and find their work accessible is going to be unique to them. So I think once you've had that conversation, it's about thinking about adjustments. And I think adjustments are kind of really, really important, because when we think that 3 in 10 autistic people are in paid employment, it's a shocking kind of statistic. And organisations like AWP and other kind of NHS services, we should be at the forefront of kind of thinking about kind of how we can include autistic people. So for us, reasonable adjustments aren't just about kind of focusing on the things that people can't do. It's about celebrating strengths and magnifying strengths. So I think, it's about kind of thinking about the things that people need in a kind of individualised way. And the other thing I said about kind of being open is that it's one thing to have reasonable adjustments on a piece of paper, but it's another thing for kind of managers and for teams to actually buy into that and to kind of have some consistency and adhere to those plans. So I think people, need to be open and mindful and kind of really buy into things. There are kind of general things, and the general things really, they're not going to just help autistic people, they'll help everybody. If we're all kind of clear and concise with communication, if we're all mindful of the sensory environment, if we're kind of explicit in kind of what we're asking from people, it's probably going to help autistic people, but anyone will benefit from that too.
Thank you. Oriana?
If an autistic colleague feels able to share that they're autistic, that's a really big deal. So there's something about setting the environment and the culture in your team, isn't there, for people to feel able to declare I'm an autistic person, because it's not always obvious. It's a hidden disability for some. And so there's something about how we respond to somebody sharing that, because sometimes somebody might have had a late diagnosis. They've already been working in your team, and then they've been through an assessment process and they've had an autism diagnosis. And I think we should never underestimate the courage for some people it takes to declare that they're autistic. So it's really important that we respond positively to that we take time to listen, and as you were saying, Kez, to ask the person what it means for them, because no autistic person is the same as another person, just as human beings we're not. And then to listen to that person, the strengths that they feel they bring to the job, but also to understand the challenges. So as you said, that you can start to think together with the person that you're sharing with about what some of those adjustments could be that mean you could really thrive in the workplace. So I'm always very mindful about somebody sharing that information with you. And I think another important thing to say is that for an autistic person, they don't have an obligation to share. It's not something you have to declare, is it? No. You choose to do that. So how we receive that, taking time, listening, understanding the person's experience of autism as they're making sense of it too. And then I would also really ask that you seek some really reliable information about autism, because it's helpful maybe to have your own views challenged about what autism is, so that we don't get stuck with a stereotype and make assumptions about the person in the workplace. So I think if you look at that comprehensively,
No, definitely. And I think, people often say if you've met one autistic person, you've just met one autistic person. So
Exactly.
you have to really think in an individualised way. And you're right around disclosure. There are many people that literally wear the t-shirt and are very out and kind of involved with neurodiversity movements.
Yes.
And it's a real core part of their kind of identity. And there are other people that are more guarded with that information.
Yes.
And maybe they're aware of some of those misconceptions or stereotypes or generalisations that people may have. So yeah, it's very important to kind of approach this in a real individualised way and have as many opportunities as possible to facilitate those potential discussions. Because even if you think about kind of supervisions or team meetings or whatever, some of those maybe are not conducive to that. Maybe it's better for someone to communicate it via email or to write it down to you, or so trying to remove as many barriers as possible to enable these kind of discussions about the differences that people might experience, that's going to help them kind of sustain their role, but not just sustain it, kind of excel and have their kind of skills and strengths magnified.
Yeah, absolutely.
Thank you very much. So Ben, you're involved in NHS care and treatment reviews, aren't you? So why is that so important?
So just off the back of what we were talking about just now, I would say that for me it's really important because I found it very hard to sustain work for a very long time. Went to college and trained in various things, but unless someone is adapted and understands your challenges, it can be very difficult sometimes to continue working, and I kept getting signed off and not coping in the workplace. So in a way, the work that I do with AWP and with the Autism Service and the care and treatment reviews gave me a chance to feel that I was contributing, gave me a chance to use my lived experience in a really positive way and turn around things that have been really challenging in my own life, to give back and inform care for other people so that they can have a better experience than I'd sometimes had. And I think dignity at work, earning a wage, being part of a team, you can't underestimate that. So I think if you can adapt and listen, it's really important. So care and treatment reviews were set up for those who are autistic and or have a learning disability, who are spending a lot of time in hospital to review their care and make sure they feel safe, that their voice is heard, that they have advocacy, that there's a proper discharge plan, that they don't languish for years in hospital unnecessarily. And it's set up so that you sit on a panel, there's a clinician, there's a chair, and there's usually someone with lived experience. And that's where I come in. So I go along as an autistic person with lived experience of obviously living as an autistic person, using services myself, very similar. And I think it's really important because having autistic is nice, and the situation is very different than, say, a clinician who's reviewing care. So that's really important. Of course it is, to review medication, to review discharge plans, etc. But to have someone there who can say, I've been there, or I can see that's a really stressful environment for that autistic person or person with a learning disability, and here's what I think could improve that. And there have been many times where I've sat in reviews and the person's not said very much and they're looking downwards, and then I've been able to say, I'm autistic as well, and I'll look up and suddenly start engaging, and it's like suddenly there's some hope there that well, if you're doing this, then perhaps one day I could leave here and do something. So I think it's important on many levels for advocacy to review a situation as an autistic person and to give that really sort of one-to-one focused care to someone as an autistic person.
That's great. And leading on from that, you've been involved in some autism audits, haven't you?
Yes.
Ben, of our wards, to see how our wards at AWP, our inpatient wards, how they're suitable for or more suitable for autistic people. Can you tell us a bit about that?
Yes, and the audits I've been involved with are called sensory audits. So they're primarily around looking at the environment to see how adapted they are to the sensory challenges that an autistic person probably does have in a ward situation. So a ward, especially a mental health ward, can be really hard for someone with autism because of the bright lights. It's often very unpredictable, it's often very noisy with alarms going off, jangling keys, shouting. It can often shiny floors, things very reflective. If you think of all those things together, it might be there's lots of artwork on the wall, or things are very cluttered, or things that staff might think are really helpful. And actually, when you go on to the ward, it's really overwhelming. So the audits really are about reviewing all those things using a checklist when we go around. And one of the audits I was involved with was on a secure ward, where there were people with autism and or learning disability on the ward, and with the help of a forensic psychologist, we put together what's called a toolkit that can be adapted to other areas now to look at the sensory environment of other wards. So we've used the same checklist now in mother and baby unit, the mental health ward, and we'll be using it in the eating disorder service soon. So it's now being used in other areas as well, not just Bristol. That's really rewarding.
It's fantastic.
Yeah, it's a great outcome.
Yes.
That kind of individualised stuff is just so important as well, definitely, in that, because often professionals and different people can set up spaces in what they assume can be workable for autistic people, but often those kind of assumptions can be more disabling than enabling because they're kind of coming in with their own version. So yeah, having more kind of individualised perspectives to that is always better.
Yeah.
You know, kind of tied to what you're talking about, I guess, at BAS, we developed those autism hospital passports that people use, and kind of, I guess, in recognition of some of the kind of, you know, stressful and, you know, situations that autistic people find themselves in when they're navigating the care pathway. We kind of created these autism hospital passports where people can make an individualised kind of reasonable adjustment document, and the idea is that gets uploaded to kind of local hospital systems, and they have a hard copy, a digital copy, and a wallet-sized card that says that they have one. And the idea is that kind of clinicians are using this to inform their intervention before they kind of jump into things, which maybe that approach might not work.
The Bristol Autism Spectrum Service, BAS for short, is a multidisciplinary team providing a service for adults registered with a GP in Bristol, North Somerset and South Gloss. Kez, can you provide us with some details of the BAS service and what it does?
Yeah, so we are a diagnostic and a post-diagnostic service for autistic adults in the Bristol, North Somerset and South Gloucestershire area, as you said. And so we are delivering diagnostic assessments for adults in different ages. And then for those that have a pre-existing diagnosis, whether it's through us or elsewhere, they're able to access some post-diagnostic support. So we run advice services across those regions. And in our advice services, we have bookable one-to-one appointments where autistic people can access that multidisciplinary team, so social workers, link workers like myself, and assistant psychologists, nurses and so on. So we've usually got the right clinician to book them in depending what the issue is. So maybe a practical kind of benefits housing, we've got social worker, something relating to kind of autism and their diagnosis, maybe we can book them in with the nurse. So alongside that, we also have a training and liaison bit of a team, and they kind of deliver training and kind of advice and guidance for other kind of NHS teams and also kind of social workers in the local authority. Because our approach at BAS really isn't that all autistic people should be getting all of their support from us. It's that they should have equal access to mainstream services. So a lot of what we're doing is about enabling other teams to be better equipped to support autistic people. We're often kind of the chief hasslers for autism and kind of trying to ensure, that services are kind of working with autistic people in a way that's going to work for them.
So what work do you do with the BAS service yourself?
Yeah, so you mentioned I'm a senior Autism Community Link Worker, which is a mouthful, but essentially there are 3 link workers within BAS, and it is a social prescribing intervention. So we used to be called social prescribers, but actually many autistic people in our service would see the word social and they would tell me to go away. And unfortunately, many autistic people have experienced a lot of barriers in kind of social situations, connecting to groups, whether it's in barriers within education and so on and so forth. So that word social is kind of almost a loaded word. And what we do as community link workers is that we meet autistic people in the community and we support them to access social and community opportunities. So the idea is thinking about quality of life, like what things would people like to access, what are their aspirations, what are their goals, what are the barriers to doing those things. And the link worker will work with them to kind of break down those barriers and support them to access the people and the things that are important to them in a way that feels safe and comfortable for them. In 1 week of my kind of job, I've supported somebody to re-engage with their Catholic faith, and we've done some travel training after researching places for them to do that. We support them to go along to, and now that's something that they do independently. In that same week, I supported somebody to get involved with the Bristol drag scene. And again, we did a bit of travel training. We kind of contacted that group ahead of time and got some reasonable adjustments in place. And I went along with that individual for a kind of a few times, that kind of sturdy point of difference. And then, we pull away, and now they're kind of doing that independently. So it's very person-centered support, and it's thinking about the things that people would like to be different, but maybe they're anxious about kind of doing it, they're unsure how to go about doing it, and the link workers are there to try and make it happen.
Great, and of course the BAS service has also supported the UK, hasn't it, as well?
Yeah.
So would you like to tell us a little bit about that?
So I've been going to BAS for probably just over 10 years now. About 9 of those years I've been peer mentors. I was in the service, but the first year I went, I was going to groups, support groups there, doing a few workshops around what it's like to be autistic. And I saw a few peer mentors in action, and I always had a sense that I really wanted to get back into the service, because I'd used mental health services for a while before that and felt I had a lot to give. So I asked if I could look into being a peer mentor, and I did the training. Doing more experience, I started doing other things like helping with co-facilitating workshops. I've done lots of co-facilitation around the what's called Being Autistic group, which is when people are newly diagnosed, there's a lot of change and a lot to process very often. Sometimes grieving, sometimes anger, sometimes it's just really, really positive for someone. And there's all different ages of people, lots of different things come up because of your different age and life experience. So we run a group to support people on that journey, and that's something I help co-facilitate. I've also helped with training, so training mental health staff within AWP with usually a clinician and a trainer from BAS. So that's really interesting. I love doing that. There's so much more that we do as peer mentors. I've gone blank now, but there's a lot. So it's a wonderful role. And I think BAS supports me through letting me do that, because I love it. And I couldn't think of anything I'd rather do generally being that. I love doing it. And the fact that BAS I think is a fantastic team at actually levelling the playing field. So I feel very much part of the team. It doesn't feel like I'm in a hierarchy at all. And that's really special. It's quite unusual, I think. And I thank Bass for that, really.
Yeah, that's great. And of course we do workshops, don't we, here through Bass at AWP to help autistic people.
Yeah, so Ben mentioned that being an autistic group, and I guess, firstly, we're very lucky to have Ben on board with us. I think that, you put me to shame, certainly, in all the things that you do, to be honest, Ben. But yeah, we have, in that being autistic group, which is like the core thing that we do, I guess echoing what Ben said, I think it's probably one of the best things that we do, because we have people that are new to the service or newly diagnosed, coming from different backgrounds, different demographics, with different lived experiences, and it's, we do a bit of content in terms of helping people understand that diagnosis and contextualising it to their own experiences. But the best bit about it is creating this safe and structured environment for autistic people to meet other autistic people and connect their experiences to other autistic people. And often what you see is like people feeling less alone, and kind of people in their 60s in a room with people in their 20s, and they kind of, you do that as well. I thought that was a me thing. And then kind of being able to make those connections over 6 weeks, it's been a fantastic thing to be a part of. And also it seems to be one of the best and most rewarding things that we do in terms of what people get out of it. So yeah, and I think with any of our groups that we do, I mentioned being a safe and structured environment, and I think that's the key to it, is that it's obviously there often is workshops where we're giving information, we're trying to kind of do some psychoeducation, as it might be called, but the core thing is about trying to create a space where autistic people feel included and able to share their experiences and kind of connect with other autistic people.
That's great. Yeah. Amazing, yeah. And of course, AWP is currently building a new learning disabilities and autism service on our site at Blackberry Hill called the Kingfisher. So if I can turn to you, Oriana, how will the Kingfisher support and improve care for people with autism and learning disabilities?
So the Kingfisher service is an inpatient service, and it also has an integrated outreach team as part of that. And it's been provided by AWP as part of a regional innovation to make sure that we provide the right care and the right support and the right environment for people that are autistic and for people with a learning disability, and sometimes both. But essentially that they're experiencing a mental health crisis, and it's been a challenge regionally and nationally to meet the needs of people. What often happens is that people then have to go out of area for specialist support and provision. But that means then that for the person they become disconnected from their community, from their families, from their social life and interests, and also from their jobs potentially too. So the Kingfisher service, we've been working across BSW, so Birmingham, Swindon and Wiltshire, and also with Bristol, North Somerset and South Gloucester, to transform the pathways essentially end to end, to ensure that we've got local care for autistic people and for people with a learning disability wherever possible. And those pathways include, when you were talking earlier, CARES, they include that access to mainstream and specialist community and inpatient mental health services. We're not trying to prevent or change that because we want people to be able to access them. But there are still times when people need what we've described as an enhanced therapeutic environment where they might need a period of inpatient care in an environment that is very much designed around considering people's sensory needs, paying attention to having an environment that thinks about the noise and the light and all of those things that you were talking about, Ben, in respect to the sensory audits, for example. But the outreach service is integrated into the team there, so that if we can work to prevent an admission, we work with our community partners, including mental health services and the voluntary sector, but also importantly working with families and carers too. If we can stabilise the situation in someone's community and prevent an admission, then we'll do that. But if it's clinically recommended that someone has a period of time in the Kingfisher inpatient service, that we have discharge in mind. And that's a really important thing to be planning on admission, because as Ben was talking about the CTR reviews, where we know nationally for too long people have been languishing in hospital, we're actually tasked with ensuring that a person stays between 3 to 6 months. So again, another improvement for autistic people and people with learning disability in terms of inpatient mental health care. And what's really key to this working, and that's been a big part of the programme of work, is around that collaboration with partners, working with services like BAS, working with community services, as I mentioned, in the voluntary sector, and also working together to ensure that we have a workforce that are really skilled and knowledgeable and experienced working with people with a learning disability and with autistic people too. So we have a team that is a really rich multidisciplinary team that includes a consultant psychiatrist, psychology, occupational health and speech and language therapy and therapies. But also what's really important to us as well is that in our workforce we have peer support workers. So just as you were talking about, Ben, that having people with that lived experience, either of mental health care or being an autistic person, who can come alongside people when they're either in the community working with the outreach team or in the inpatient service, but someone that you can connect with, someone whose experiences are real and lived. And I think what you'd said earlier on that was really powerful is also that offer of hope, that there's a hope of recovery. This is where I'm at now, but also this might be something, this kind of role might be something that I can do in the future. So lots of improvement and support for autistic people and people with learning disability.
That's great. And of course, Ben, you've been involved, haven't you, in the development of this new service, which is going to be called the Kingfisher.
I think, I know it's really important, as Oriana said, that the team developing the Kingfisher service, that lived experience was very much at the heart of the design and development, and that was from the start. So I was asked to come on board when it was first being thought about, and to help put a group together at the autism service that we've spoken about, where we could form like a feedback group that we'd meet regularly with some members of the development team, design team, but also the architects who came regularly to kind of give us the ideas that they had right at the start, and to feed into those ideas what we thought, and that was things like the layout, the lighting, the acoustics, things that colour of furniture, garden design, planting, that kind of thing. So that was several years ago now, actually, it's been a long time. And this obviously now it's changed a lot, the building is now going up, but we still have a very active group. So we still meet with the design team, with clinicians who come to BAS to talk to us. We're hoping as the building continues to go up, we'll then do site visits, and as things are then kind of really finalised before it opens, we hope to go back and keep feeding into it. I've been very involved in going into different meetings like the clinical group, and I've been going to like a green group, if you like, so if that's the correct term. So it's looking at all the green aspects of the Kingfisher. So therapeutic care that's around what that might look like if it's has gardening or nature, animals, that kind of thing. So yeah, it's quite varied what I'm involved with at the moment. I'd really like very much to stay involved, but I feel like my involvement is very much around bringing autistic people together to speak into the design. I think it's so important because in my care and treatment review work, I've been to many places, some really good, some very adapted. Been to a few that aren't so good, and I think when they're not so good, you see it directly impacting on someone's state of mind, their recovery, how long they're in for. And I think the thing of hope is really important, because in a review, when you come across someone who's just lost hope because they've been there so long and they're miles away from family and friends, it just shows how important it is to have a service like this that's local, that's adapted and gives people hope. And that's why I'm involved, really.
That's great. And I guess design is so important to have that welcoming feeling when you're there.
We've been doing that work with hospital rooms at the moment as well.
Oh, yes,
Which has been great.
yeah.
So hospital rooms are kind of a charity that kind of worked, to think about what the art is going to be in these kind of spaces, and they've been coming along to those kind of groups with you, and they're getting kind of practicing professional artists that are also running workshops with our guys at BAS. You have to think about kind of what that art's going to be, and that's really good to see that. And I'm looking forward to going to a couple of those later in the year.
Yeah, that's been good fun.
I was just thinking, I think the whole kind of programme of work that we've been embarking on together has been, centred on that principle of nothing about us without us. And just when you were talking about all the different areas of co-production and involvement, that's been so important, because quite often it can be tokenistic, but actually there's, having that autism voice and everything that we're doing is so intrinsic to the work, isn't it? And everything from, as you said, that the early design of the building and the bespoke nature of it, through to the recruitment of our workforce and team, not having any interview panels without a person with lived experience on the panel, so that we're recruiting and selecting the right people with the right attitudes and the right gifts, right through to the detail that when you're working with somebody with lived experience, that particular autism, that detail, the nuance, helping us to prioritise things that maybe we wouldn't have seen as important, but they truly are. So, we've had workshops together with the BAS group around the colour going on the walls, but it's really important because colour can affect people, particularly autistic people, for some of them. And then, as you mentioned, the hospital rooms charity work, and that's not just been about the artwork, it's even about the artist, isn't it? I'm thinking about where that art will go in the environment, because we're looking to create a really valuing space in the inpatient service for people when they're with us during their treatment and recovery. And I think the other thing as well, Ben, that's really important in how you connect us with people with lived experience for the work is that you call us out and challenge us, and often say the things that people might be thinking and not be brave enough to say in a meeting. That really strong theme of advocacy, that actually for all of the people that worked with lived experience have not shied away from, because this is the opportunity to get it right, isn't it, together.
And I think people have different ways of communicating feedback, and it goes along with the first question around adaptive work, because there needs to be different ways that giving valued, really authentic feedback is enabled within something. So some people are very vocal in a group, and they're able to say, other people just sit there writing and then they hand it afterwards, don't they? And it's in written. Other people email me afterwards or send me a voice note, which I then transcribe. So everyone has a way that they can feedback, and we try to adapt to that so that things that people highlight that we just haven't thought about, nothing's lost.
Exactly that.
That's one of the best strengths, I would say, about working with autistic people is, kind of, I guess, out of the box thinking and different perspectives, and that kind of unique perspective often kind of counters what people assume is the right way to approach things, and it takes involving people with that lived experience that kind of go, have you thought about this, or actually that's not going to work, or they're kind of picturing what it would be like to be in those spaces, and I think it's totally great. And I guess we've always had this kind of Involvee work at BAS where it's kind of maybe helped us write workshops or kind of change content and make sure it's relevant. But I guess what's so cool about this is kind of something from the ground up, from architect plans to something that's going to be a tangible service. And that, that word hope again is so good, like especially kind of creating roles specific for autistic people with lived experience, because I think it can't be underestimated how important that is. So, through, for example, one thing I didn't mention is that we run a garden at that, so we have an allotment and we have a gardening space. And I was able to get some money through Headlight, which is AWP's charity, and through that money we paid 2 autistic people to help us run these spaces. And I know that we did, it was on one of the Involvee days, and people were kind of asked what they liked about that opportunity, and one of them was like, I like being paid. Because actually, it can't be underestimated that often there's so many barriers into these opportunities that if you can create some, it's great. So it's good to see them in the Kingfisher.
And that's really important to bring through, that those are paid roles, they're genuine roles, people being employed and to be involved in the inpatient and the outreach service. And I think what's important as well is the continuity of what we're doing. So I know we've been in this long stage of design that you've described, and and the ward is being built now. We can see this coming to life, but it can't stop there. And by having people with lived experience in the workforce, working together, constantly listening to what our patients are telling us, and that we continue to have that autistic voice represented, listened to, and it informs our practice, that we're constantly striving to improve and have good quality care for people.
It's like having the eyes on it still,
Exactly that.
Independent advocacy is great, I'm not knocking that, but it's different than having the lived experience present somewhere. And I think that does have to continue in order to make sure it remains a place of hope and recovery.
That must have given you, Kez, some great satisfaction creating jobs, actually creating 2 jobs potentially.
Yeah, so that as I said, that in a way we weren't necessarily paying them because they were autistic. They were actually much more skilled and knowledgeable about gardening than I was. And again, about building something that was with autistic people from the very beginning. That space has been defined by the people that access that garden and that allotment. And it's been great to have them on board. And I think that thinking about the gardening group specifically, I guess we know that connecting with nature, if you're a fan of evidence-based stuff, there's just so much evidence to suggest that that's a good thing. So being able to create that space has been fantastic, and I know that people have found it a real safe space to kind of socialise and meet other people without a lot of pressure, because we're focused on specific activities, we're kind of in a less kind of pressurised environment. And to do all that, and then also be able to pay some autistic people, has been fantastic.
And it's amazing actually how that work with the allotment and then our connection with Ben has really driven one of the sort of key offers in our therapeutic offer at Kingfisher, which is around working with nature-based practice. So of course it will be trauma-informed, and we'll have all of the evidence-based therapies, but as you said, there's that increase in evidence base of the benefits of living and working in and therapeutically engaging in nature, so scaling that up.
It's a really nice site, isn't it? It's like very wooded, lots of trees and nature, so it's great.
And it came into the design too, didn't it? Because for each room, each room has its own garden. And again, we're just starting to think about how might that space be used, how might you engage in that with things like mindfulness. It's just lovely hearing how all these things are sort of becoming joined up and scaled up, because the benefits that autistic people are telling us we have when we have access to nature, to daylight, to sunlight, to being able to see the sky and
animals, birds, things
exactly that.
Grow.
But it's been really good. I mean, with that nature and with the Kingfisher, we're also connecting with hospital rooms again. So what I do, another thing I do as part of the Link Worker project, I've set up a social group which operates each month, and it's a different community location across the kind of local area. And the idea is that just because something exists, and even if it says that it's autism friendly, many autistic people aren't going there, and that's for a range of reasons. Like they have to get there, the anxiety that they've experienced about trying something new, and all of those kind of things. So we do these structured social groups where we try to encourage people to come out, try something new, meet other people in a kind of safe way. But we've done a lot of walks with that as well, alongside going to museums and galleries and so on. But we're going to go with hospital rooms, and we're going to be doing a walk up the Froome Valley with some of the artists, and so it's very much connected, and it's good.
Absolutely.
Absolutely. We'll talk a lot about the Kingfisher service, which is going to be our autism and learning disability service. But I guess, what culture are you hoping, Oriana, to embody there?
It's a really important question actually around the culture, particularly in relation to working with people with learning disability and autistic people. So, providing the right culture, having a positive patient and carer experience is really at the heart of what we're developing. And so there is that focus on the clinical interventions and that whole patient pathway and journey in and out of the service, but it's about having a shared vision for a positive and open culture, and one that's co-produced. Again, we have to have that lived experience voice in creating that, so that Kingfisher then is a really valuing place. We've talked about being valuing in terms of the environment and the space we're providing, but it's also in terms of the relationships and the therapeutic relationships and the engagement. I think that's where the nature-based practice really spoke to us actually, Ben. I remember having a discussion about it because we could really see the potential for conversations on the ward not just being about, not purely clinical and not about your medication and all those things, but being able to talk about nature and the things that we're involved in. But also it's one where we want staff to feel confident to be able to raise concerns, and for our patients, as I'll be on the Kingfisher Inpatient Service, to be able to raise concerns, for those to be listened to, you don't want that fear of reprisal, and so there's a work around that, and also one where for our staff they feel physically and mentally well too, to be able to do the job that they're doing. We know that in care sometimes people can get burned out or compassion fatigue, so we also have to have that culture of making sure that we have good and meaningful supervisions, good staff trainings, good staff engagement, and also that dynamic and that relationship between staff and patients, and that we take time and care to really get to know each patient as an individual, so that our engagement is meaningful, makes sense to the person, and that our interactions are positive. And we're very much working with the culture of care standards, and this is a regional vision that we're creating. So it's not just about the services and it's not just about the staff, but it's also about the wider system that we're working in, and how we include people. And again, I think the importance of lived experience involvement in that is being able to be a critical friend, to be able to raise things, to be able to challenge things, not to stereotype and not to make assumptions. So much about the communication and our relationships is involved in that, to have safe services, and services where people are genuinely cared for and listened to, and we act upon any concerns.
Great, and of course, Ben, the autistic voice has been really at the heart of the design of the Kingfisher. I'm sure you're passionate about keeping it there as well as the service continues and develops.
Yeah, very much. Yeah, and I think that's where the peer support work's going to come into. Also, audits, like people visiting, care and treatment reviews. There are lots of different ways that autistic people and people with learning disability can be brought in to review things and look at things. And I think that open culture is so important, because I've been to places, and I've been in places that feel very closed and where feedback is tokenistic they're not taken seriously. And I wonder how safe it is within those cultures to flag concerns. So it's really good to hear that the culture is the whole goal, for it to be open and supportive to staff relations.
And I think we've, just in the way that we've been working in the whole design and delivery, we've been setting that culture. We're doing that now, and a bit like I was saying earlier on, we don't want that to stop when we open our doors. It's an ongoing process. Culture isn't static, it's dynamic, it keeps moving. Yeah, we have to keep checking that and sensing it, and again, we can only do that with people with lived experience and their families.
I guess it'd be hopeful to, you mentioned like the culture and thinking about the region,
Yeah.
but almost it can become like an example, and then, you know, that spreads in terms of the values, because, you know, there are so many structural barriers that kind of autistic people face out there, whether it's accessing services, whether it's the employment stats I mentioned, whether it's loneliness and isolation, all of these kind of things. So having a regional based kind of approach to kind of thinking about, well, how do we stop that? That's not good enough.
Yeah, exactly.
It's really good.
Yeah.
That's great. Well, before we close, is there anything else you'd like to add, Oriana?
No, I think we've covered things really well, and you know, just as I say, just being able to think, you know, just to have this moment to reflect and think about everything that's been achieved so far, and also the hopes and aspirations for what comes next. Yeah, it's been really great to have time with you today.
And of course, without people with lived experience, we wouldn't have been able to achieve
Absolutely.
the progress we've achieved so far.
Yeah, absolutely.
Ben?
Just all credit to the BAS group, really. The BAS group, the feedback group that's given so much to this, and BAS as a service. So, yeah, just want to flag that out, really. Amazing.
I'll pay you later, Ben.
Yes.
It's been fantastic to talk about all of these things, and I guess, as I just mentioned, hopefully it's the beginning and not like a full stop, wherever kind of more kind of services, whether it's in the voluntary sector, whether it's in statutory services, are kind of taking this approach and thinking about these, you know, structural barriers that many autistic people kind of experience, involving autistic people from the ground up in all of these things, and hopefully in 10 years' time we can have a conversation and some of those statistics will be better reading.
Yeah.
Thank you, Kez, Ben and Oriana.
Thank you.
Thank you.
So thank you for listening and watching. If you're interested in any of the topics we've chatted about today, please send your questions to awp.communications@nhs.net. And if you're interested in a career at the Kingfisher, head to AWP Jobs.